Hi guys, I am Dr. Ashley Hovez. I am here at Smile and Company, and I wanted to wrap up National Children's Dental Health Month with some of the most commonly asked questions that we've gotten. So it's been amazing getting to know everyone's kids and families. Thank you to everyone who has come in and visited Smile and Company. So I'm just going to get started, and if you are jumping on, feel free to type in your questions. So the most common question is, what age do you start bringing your child to the dentist? Well, the AAPD, American Academy of Pediatric Dentistry, recommends first tooth or first birthday. So I know that may seem really young to most of you, but we want your children to really grow up at the dentist. And prevention is key. So our goal is to hopefully never ever have to drill a tooth, quite honestly. So the first tooth or first birthday allows us to mostly educate the parents on proper ways of brushing. And brushing actually should start before there is even a tooth in the mouth. Hopefully you guys know that already. So just even if you are breastfeeding your baby, make sure to take a warm, damp washcloth and just gently scrub the gums, and that sets up good oral hygiene habits. So, and when to start using fluoride. So even if your child is not a very good spitter, my kids still aren't very good at spitting, well, on demand actually. We recommend starting to use fluoride at the age of 2, and all you need is a very tiny smear on the toothbrush, not even really a lot to even see on the bristles, but you know that there will be enough once you start brushing your kids' teeth, and you'll start to see some foaming action. So even if they do swallow some of that fluoride, don't be alarmed. It will actually, that fluoride will help with the development of the adult teeth. So start using fluoride. And I know that some parents are just scared of fluoride, and I use fluoride on my kids. I don't think it's the devil, but if you are against fluoride, then we are not going to make you do fluoride. That is completely up to you and your parenting style. So what else? Oh, okay, so a lot of questions that we get are, do we really need to do this treatment? Aren't they just baby teeth? Won't they just fall out? And that is a very good question, because you think that they're just baby teeth, they will fall out, but the molars, so let's talk about your baby teeth, your baby molars. If they have decay, they actually do not fall out until closer to the age of 11, sometimes 12 or later. So if your child is 4 and there is already signs of decay and it's getting close to the nerve or the pulp, you definitely want to get those teeth treated. You don't want to risk abscesses or infection and missing days of school. So baby teeth are important, and we don't want to dismiss any kind of bacteria in the mouth, because dental caries is it's the most common disease amongst children, and it's the most common reason why kids are missing school. So please, even if you seek a second opinion, sedation dentistry is actually the safest way to treat kids, especially really young kids. I know for a fact that I have 2 young boys. If we ever found decay on them, they would be sedation cases for sure. I can barely get a toothbrush in the mouth. So just don't. So a lot of the I'm not a pediatric dentist. I'm a general dentist. but I'm a mom who loves treating kids, and I worked in a pediatric office for almost 5 years. So a lot of the questions were, why can't you just hold our kid down and just get it done? Because they're scared, and I get it. Like, now that I have kids of my own, it's very scary, especially if you hear about the rare cases where something does happen. And my response is this: putting a high-speed drill in a moving target is way more dangerous than sedation. So I would do it if my kids needed treatment. And if you have questions about treatment plans that you've received, I'd be happy to answer them. And thank you, everyone, for joining. How do you brush a wild toddler's teeth appropriately? The best way, actually, is to let your husband do it. Yeah, that was my husband. We have crazy kids. And the best way, actually, is to tag team. If you have another adult present, I know it sounds funny, but if you have the child straddle you and then you lay their head in the other adult's lap, one of the adults is able to keep their legs and their arms steady, while the other adult is able to stabilize their head and hopefully get a toothbrush in. And if your child is young, even if they have a full set of 20 pediatric teeth, you can put your 2 fingers on the gum pads where their 6-year molars are going to grow in, and that is going to anchor their jaw open. And it's actually awesome if they are screaming their heads off, because their mouths are wide open. So we would rather have you go through that every day than have them scream at the dentist. So would you suggest using disclosing tablets? Yes, absolutely. We love disclosing tablets because it shows you exactly where you are missing. And honestly, if a child is not adept at writing in cursive, which is normally around the age of 8 or 9, they don't have the manual dexterity needed to really clean the plaque off of teeth. I mean, to think that adults most of the time are missing a lot of plaque along the gum line and in between teeth, I think it's unrealistic to expect our kids to be able to do this job on their own. So disclosing tablets helps the parent and the child see exactly where they're missing. And I am missing a lot of calls because Judy is not in the office, right? It's our day off. So what else? And we offer, honestly, we just want to meet everyone's kids. I know February is over, and but if you don't have a dentist and you're looking for one, we would love to have you come in and just have a conversation. What tools would you recommend using for kids with braces? Judy, you are putting me on the spot. So there are there's super floss, which is a thicker floss that you can bend and get in around the brackets. So I'm a big fan of the Oral-B toothbrush as opposed to the Sonicare for braces specifically, because the head is small and round and you can actually focus on each individual tooth. And water flossing. So I don't think that water flossers are going to replace traditional floss, but I'm a big fan of using anything that you will actually use and implement. So your kids need, you're so funny, Judy. If you can set up your orthodontic appointment to coincide with your regular dental appointment, that would be the easiest way to make sure that that you get in there and get all the plaque out. And I guess no one else has any questions. So we offer complimentary infant exams under the age of 2. So if you have a baby, just bring them in. I'd be happy to take a look at their gums. And I've been tagged in a lot of Folsom chat posts about eruption cysts, which is basically, they're kind of scary looking. When a tooth is about to break through the gum, it can look like a bluish bruise on the gum. That can even be a bubble. Don't be alarmed. That is an eruption cyst. And once the tooth breaks through, it resolves. And in the rare cases, we do help it along, but I prefer to let nature take its course. So we just usually have the parent just keep massaging it until the tooth breaks through. What else? So as a mom, so I don't have any dental background on this at all, but have you guys heard of those amber teething necklaces? Yeah, there's no like JADA article about it, but I swear they work, because our son was waking up every hour when he was teething. We bought this on Amazon for like $20, and he slept the whole night through, like for the first time. So if it's voodoo, it's voodoo. Like I said, I'm still a mom, and this is how I practice. And I mean, that's what works. So if you guys have any other questions, feel free. If you have families, we love treating families at Smiling Company. We are super fun and casual. Know my coats. We have lots of stuffed animals and prizes and leftover goodies from this month. So yeah, thank you for watching and joining, and hopefully we can have more of these sit down face-to-face where you guys can just type in your questions, because I know going to the dentist can be intimidating. So yeah, we want it to be we want it to be fun and casual. So thank you again for joining, and stay tuned for the next one. Bye guys.